Hi, I'm Cindy Jones, and I'm one of the founders of Bi-Tapp. And today I'm going to be visiting with Rhonda Marsh, who is an occupational therapist. Rhonda, if you could just share with us your specialty as an occupational therapist and how you first were introduced to the tappers.
Hi, so I am a certified hand therapist. I have been specializing in treating arm injuries since 2006, and I was introduced to the BiTaps by a patient of mine, about 4 years ago, I think. She came into the clinic and was experiencing a lot of pain, and I was concerned that she had complex regional pain syndrome. And I was trying to educate her on the role of the sympathetic nervous system with pain. And so when I told her that part of this was a fight or flight response, she goes, "Well, so it's my anxiety." And I said, "Well, no, not exactly." So we had a long conversation. And what we realized was we were talking about the same nervous system. Her experience with the sympathetic nervous system was through anxiety when she had gone to work with a trauma therapist. And my experience with the sympathetic nervous system was through treatment of pain. So we realized we're talking about the same nervous system. And we decided to go ahead and have her try using her BiTaps to help with her pain at home.
So, how did you start using them in the clinic? And then how did you decide which patients you would want to use the tappers with?
So I first had this patient of mine. I asked her after she used them at home and had success. I just said, will you bring those into the clinic during your next therapy session? So she brought them in and I had her put them on and I had her teach me what she was doing with them because I had no idea. So she put them on and I had her wear them up on her forearms and we just went through her normal therapy session. We had her doing her range of motion exercises and her scar massage and everything that we would normally do, but allowed her to regulate her nervous system while wearing them. And it made therapy so much more tolerable and so much easier on her. And I just was blown away. So I asked my manager if we could order a set for the clinic so I could start trying them with other people. And so what I decided was if someone came in and they were anxious about therapy in the first place, just nervous about what we were going to do, was it going to hurt? Were we going to make them feel worse? I would just ask them to try them. I would just tell them that we're going to try to distract your brain a little bit and see if it makes therapy more tolerable. I've kind of gotten a little bit more fine tuned when I'm choosing to use these with patients now. If someone reports to me that they have a burning type of pain, and I'm concerned that it's coming from the nervous system rather than from scarring, I will have them try them. But I also just try to notice if they're anxious or really apprehensive about what to expect in therapy. We'll put them on.
Well, that's great. And then I know you're also, you specialize in like understanding pain and trying to find solutions to help people all the time. And, I know there's a pain scale, 0 to 10. And so, what have you noticed with people, whether, and it might be different if it's acute pain versus chronic pain, but when they're using the tappers, what have you noticed?
So when it comes to pain, I've really started researching more into it over the last about 3 years. I've been doing a lot of research into Adrian Lowe, his research that he's published. He's a physical therapist. Um, and so what I try to do is educate patients about what pain is and about how the brain processes incoming information to determine what is painful and what is not. And in Adrian Lowe's research, he talks about the 9 different parts of the brain that activate during the pain experience. And the number one on his list is the amygdala. And in his book on educating patients about pain neuroscience, he talks about that the amygdala is the most active part of the brain during the pain experience. So I just thought, gosh, this really adds up. If we can help keep the amygdala busy with the BiTaps, then maybe we can tone down the pain experience. So if they're having high levels of acute pain, we can tone it down to make therapy tolerable. If they have chronic pain and that amygdala has been active for a long time, we can tone that down so that way we can start to make some headway on increasing their activity tolerance in a chronic pain experience.
Could you explain to us what complex regional pain syndrome is and then how the tappers might be able to help with someone that might potentially have that syndrome or already has it?
So complex regional pain syndrome is nothing short of its name. It is complex. But I mostly see it as a secondary diagnosis when someone has had an typically a traumatic injury. And what happens is their body gets stuck in fight or flight. They are very much stuck in a sympathetic response. So we see a physical manifestation. So we often see swelling in the hand, we'll see shiny skin, we'll see abnormal hair growth. We see typically pain out of proportion with their injury that we would expect. Although some people have complex regional pain with no pain, we just see the swelling and the shiny skin and the hair growth without the pain component. But what it does is the Bi-Tapps gives us a way to address the sympathetic nervous system without having to go through taking medications and having injections. So for a patient that wants to try something a little less invasive, this is a good starting point to see if we can influence that pain at all. But complex regional pain is a really tough diagnosis to treat. So it's like having one more modality, one more tool that we can use really helps in that multimodal treatment approach for the patient.
That's impressive. I also just want to ask you, are you or using them in your personal life, or do you have any examples of maybe friends that are using them just to show just an expanded use? So obviously you're using them in your professional life, but in your personal life, is there any examples of someone using the tappers?
Absolutely. I'll use them just for stress. If I have a really difficult meeting to go to, or, you know, something that's just stressing me out, I'll put them on. I'll tuck them in my pockets and wear them for the meeting. I even loaned, I have a personal set that I keep at home, and I loaned them to a friend of mine who was in a car accident, and she's using them to help her with sleeping and to help just with when she gets a lot of headaches from all the stress and anxiety as a result of her car accident. And they have helped her immensely. She can finally sleep better and just feels much more regulated. And it's allowing her to move forward in the rest of the treatment that she needs to get her health back on track after her accident.
Well, I just want to thank you for your time today. It's really important to Haley and I, the other founder, that we just share examples of just the many different ways the tappers can benefit people. So I want to thank you for your time today, Rhonda. Thank you.
You're welcome. It's a pleasure to be here. Thank you.